I think he's latched onto this bill and is fear-mongering on the bill and essentially, covering over all the harm done to Washingtonians through taxes and other regulatory bills passed by the majority Democrats and signed by Governor Ferguson. And so instead of actually just trying to knuckle down and do the hard work of governing a state, he'd rather play politics with a bill. And candidly, he's just misstating the impact. This is not, I mean, when you get right down to it, there's lots of pieces to this bill, but the one most folks have been interested in are the changes to Medicaid. But just to be clear, when you say cuts or savings to Medicaid, most of this is just accountability. I mean, even the work requirement. There's, the Congressional Budget Office says there's going to be a bunch of savings, but they don't know what's going to happen. In Washington State, if it's proportional, the estimate is around 200,000 people who are able-bodied, no disabilities, no dependents, will somehow not make the decision to work 20 hours a week, an idea that is enormously popular on both sides of the aisle, and will just lose health care because they make that decision. I don't think that's a foregone conclusion. I think a lot of them will just decide to work. Some of them may already be working. They just have to establish that. And then they don't address the fact that perhaps some of them will go to work and actually get private insurance instead of Medicaid. So there's a whole bunch of opportunities that are not being considered at all. It's always the worst case. And frankly, the idea that we should, in my view, encourage accountability in the Medicaid program makes perfect sense. This is a program designed to help the extremely poor, the disabled children, and by misusing it, by wasting money allocated to Medicaid, we're putting the whole program at risk for the folks who really need it.
Yeah, the messaging from Ferguson's office has been that what Trump is doing is making sure that, single women with 6 kids lose all their SNAP benefits, lose their health care coverage and everything else. And it's, as you say, fear mongering. So this is
And
an attempt.
it's just flat out untrue. Single parents with children aren't don't it doesn't apply. Just to be clear, I mean he's being untrue, and that's also a bit hypocritical, given this is the same guy that signed taxes, high taxes on our hospitals throughout the state, who signed the PEB/CEB bill that it is a huge financial hit to our rural hospitals in particular to now all of a sudden cry foul on this program, I think is wrong-headed. Are there going to be challenges? Absolutely. Any significant piece of legislation, either at the federal level or at the state level, will have challenges with implementation. No question about that. But we should be working to address those challenges, not fear-mongering about the potential impact to our vulnerable population.